Well, my name is Dave Dillman. I'm an ophthalmologist in Danville, Illinois. I founded Dillman Eye Care Associates in 1981. I actually made the commitment to add this femtosecond laser technology in the summer of 2012. I went to 3 different facilities, watched 5 different surgeons, and it was abundantly clear that this is a better way to do cataract surgery. So I was very eager to implement that into our program, and we were able to start it then in March of 2013.
You know, in the beginning, I think for the staff members, we struggled because it was new to us a year ago. And to try to convey to the patients why LensX is better, why A is better than B, was difficult for us in the beginning. Over the last year, it's become very easy for us to talk to patients about it because we're seeing it firsthand. We're not just reading about it. And I feel like we're at a point where we're all extremely comfortable in explaining the differences and recommending it.
I was a little worried, with the economy the way it is and the extra cost. But people have been very accepting of it, and they seem to really understand the benefits as we present it to them. I've had more people take advantage of it than I thought would.
From the get-go, Andy and I presented it that this is the right thing to do, and we need that to come across to the staff, to the patients, and as such, there really weren't any big concerns. And I think a big part of that, for someone who's not currently using this technology, is belief. The surgeons, the physicians, in their hearts really need to feel this is a better way to do it. And if they feel that, it's going to come across. And that's going to knock down a lot of hurdles. The engineer, to my way of thinking, plays a significant role during the LensX procedure. And what I mean by that, and this is an advantage of working with Sightpath, for every surgery that I do or have done, this engineer likely has done 20 or 30 with different doctors. So the engineer has seen different approaches, things that work well, things that don't work well, and I encourage them to be very verbal with me. If they see something that I'm doing that they think can be done better, I want to hear about it. And they see things on the screen that I don't see. They're looking at things that I'm not looking at. I'm looking at maybe where the eye is positioned, they're looking at where the bubbles are positioned. And so I ask the engineers to be my partner in these surgeries, and it's very helpful.
The Sightpath technicians are very experienced with this, something I really appreciate. When they leave here, the next day they go somewhere else and do several cases, and they're using the laser, getting familiar with it, 5 days a week at least. So really come to appreciate, their input on if they see corneal folds or something else that might need to increase the laser energy, and they're very, very good and professional about doing a timeout beforehand. And I ask them what they see other people do and how that's working for them and stuff, and I think it's been helpful.
Well, I think it goes way beyond the operating room. Even if the doctor does feel this is a better technology, they still have to figure out exactly how are we going to present this to the patient? How are we going to talk about money and those sorts of things? And Sightpath has lots of resources to help the physician understand how to present it to the patient, how to present it to the staff, how to do something as simple as financial informed consent, which is something that most doctors don't deal with.
The results have been really good, and there's a lot less of a learning curve than I had heard about and read about. It was very easy to learn to use it, and again, I think the Sightpath technicians kind of helped with that because they're already experienced at operating the laser. We started using it, and it was pretty helpful from the very beginning.
I think it's safer. And I think it's safer because it requires less manipulation in the eye. And I think it's more accurate because we had this real-time diagnostics that go on that give me types of information that just wasn't available before.
We are seeing the results. We are seeing the patients afterwards. We're seeing the phenomenal results they're getting. We're seeing how excited Dr. Dillman and Dr. Dvorak are. We're seeing the difference in front of us.
For the first 1 to 3 months, I was kind of blown away by the number of 2015 eyes that we had, better than 2020. And in fact, a few of my technicians said early on, is everybody gonna have 2015 vision that has Lens X? And of course the answer is no, but now that we've been into it for a little over a year, I've gotten a little bit used to it, and maybe I don't appreciate it as much as I should, but yes, our outcomes have been easily as good as I thought they would, and probably better.
Well, I guess I would say it's added a level of predictability, the computer precision to several of the steps of the cataract surgery that you just can't do by hand. So I think it's been a good thing overall.
The good news is the technology is actually getting better. There's a little interface that couples the laser with the patient, and that interface has improved tremendously in the beginning of 2013. So people who are just now getting started with it are going to have a leg up because they're going to start with a better interface. There are these things called fragmentation patterns, and that technology is going to get better just as we speak, especially for the more dense lenses. So the good news is this is not stagnant technology. This is very rapidly changing and improving technology. I'd encourage anybody to get started with it as soon as they can. Get ready to have a lot of fun. Don't be intimidated by it. The actual techniques and physical skills needed to do this surgery are not overwhelming. It's more intellectual than physical. And so my advice to someone just getting started is have a lot of fun with it, because it's really, really good stuff, and I think you'll find it to be quite stimulating and therefore very gratifying.